across the enterprise and really helps them to be fully aligned with the patient journey across the continuum of their care. That continuum, as you have heard, is only possible at a comprehensive academic health system. The model that we are creating in this merger is enjoyed by the healthiest citizens, or the citizens of the healthiest states in the United States of America. It is what Oklahoma has long needed to bring the highest quality, research-driven healthcare and innovation to our state. Our goal has and will continue to be that we use all of the means available to us in order to improve the health of all Oklahomans. Also, to assure that Oklahomans don't have to leave the state in order to find the very best care that they need and deserve in their most needful and desperate times. The new physician and provider practice created by this merger, known as OU Health Partners, Inc., is the largest provider group in the state of Oklahoma. It provides the most specialty and subspecialty expertise for both adults and children that's available anywhere in the state. It is also unique in that our new organizational management structure has physician leaders working directly side by side with operational and nursing leadership to make the key decisions and ensure excellence in patient care, patient satisfaction, quality, and safety. This merger is also an exciting advancement for our research enterprise. Research at OU Health is growing fast and will grow even faster. This growth brings new knowledge and innovations that help us to solve the most difficult challenges, the most difficult disease challenges, and find ways that literally help us to transform the delivery of healthcare. This kind of transformative work can only happen in a system that enhances the collaboration between scientists, physicians, and patients. It's this synergy of talent that transforms discoveries that are found and started in the laboratory and transforms them literally into advanced treatments that are then delivered at the bedside. It's that same synergy that takes those discoveries and disseminates them across our communities and our nations to, quite frankly, revolutionize healthcare. Being a comprehensive, fully integrated academic health system also allows us to retain our best and brightest trainees in Oklahoma. Simply put, it's here that our learners see future possibilities and want to be a part of the solutions for Oklahoma. This also allows us to recruit top physicians, physician scientists, and researchers from across the country to practice with us here at OU Health. Such talent then seals our ability to assure that no Oklahoman will ever have to go outside of the state in order to find and receive the best possible care that they need and that they deserve. Lastly, this new comprehensive enterprise can rapidly accelerate our ability to grow the education pipeline for new health professionals. As we all know, this is greatly needed in our state, and it's no secret that our need in Oklahoma is very high. This includes doctors, APPs, nurses, dentists, pharmacists, physical therapists, and so many others. OU Health provides the very medium in which interdisciplinary, team-based healthcare can flourish. This type of care is the future of health, and I'm so very proud to say that today, the future of healthcare and future of health is here. Ultimately, the greatest motivation for our merger is indeed the people of Oklahoma. Our unification efforts are now and always will be to provide our patients with ever-increasing access to the latest treatments, the nation's most talented providers, and to seamless patient care across everything that we do. So thank you all for being a part of that. So appreciate you.
Thank you, Dr. Zubialdi. Now please join me in welcoming Mr. Rainey Williams, Chair of the University Hospitals Authority and Trust and Co-Chair of the OU Health Board of Directors.
Thank you. Thank you, Jennifer. Thank you, President Harris and Dean Zubialdi, for your comments. I want to begin by thinking about Mike Sammis. President Harris mentioned he was a volunteer leader on this campus for, I think, 27 years and saw it through everything that President Harris talked about, and really was one of the architects of everything. And he would be very proud to see where we are in this step. So just great memories of Mike. Today is a long-awaited achievement for our enterprise, and one that the University Hospitals Authority and Trust is proud to be a part of. For more than 20 years, UHAT has been proud to support educational enhancements, research and healthcare advancements, and critical capital improvement projects on the campus of the OU Health Sciences Center. Today's official signing of the agreement embodies the mission of UHAT to be a catalyst for medical excellence, to support medical education and research, and to assure quality health care for all Oklahomans. Today is a pivotal moment in that mission. As OU Health Hospitals and OU Health Physicians merge into one enterprise, we are moving to a single CEO and one governing board. This will allow OU Health to continue to lead the effort to improve the health of all Oklahomans.
Excellent, thank you. We are going to sign some documents. So now, as President Harris and Mr. Williams get ready to sign documents and take their pens, I'd like to ask some of our leaders to join the stage. So Dr. Jason Sanders, Senior Vice President and Provost of OU Health Sciences Center, Co-Chair of the OU Health Board of Directors, if you can join us, along with Randy Dowell, CEO of the University Hospitals Authority and Trust. I see we have some members of the OU Health Senior Leadership Transition Team. If you're able to come up and join us, we'd sure love to have you join us. And also there's some deans of our 7 colleges that are also here today, if you'd like to join us as well. Just come up and gather around while we go through and start signing documents. Don't worry, you'll notice that they have commemorative pens. You're going to have a commemorative pen delivered to you in the next couple of weeks as a part of this moment. Make sure we get our Chief Legal Officer for OU Health up here to make sure we have everything lined around. Excellent. Gather around. This is a gathering. It's very exciting. Excellent. Are we ready? Okay. The first document. The first document is the integration and purchase agreement between the university and OU Health. It describes the restructuring of the clinical enterprise to form OU Health, the transferring of assets and employees from OU to OU Health, representations, warranties, and other commitments of the parties and liabilities pre- and post-closing. Excellent. Ladies and gentlemen, the integration and purchase agreement. All right. Next, President Harris and Mr. Williams will sign the master affiliation agreement between the university and OU Health. This document describes the parties' close affiliation and desire to align strategic, operational, and financial interests in support of their respective patient care, teaching, and research activities. It provides the contractual framework for the affiliation and identifies other contracts and schedules that support the affiliation and the parties' commitments. Excellent. The Master Affiliation Agreement. Excellent. The third document is the Academic Health System Agreement between the university and OU Health. This document amends and restates the former Academic Affiliation Agreement, states the guiding principles supporting the parties' cooperative actions and collaborative efforts leading to the successful integration of the university's academic programs with the OU Health facilities. It recognizes that clinical and translational research is an important part of the university's mission and the success of an academic health system, and will be conducted collaboratively between the university and OU Health, and establishes the Academic Health System Council, comprised of administrative, education, and research leaders from the university and OU Health. This document has an additional signature from Dr. John Zubialdi, the Executive Dean of the College of Medicine. And that's the Academic Health System Agreement. The final document, the Master Clinical Services Agreement. President Harris and Mr. Williams will be signing a document that describes the terms and conditions pursuant to which OU Health Partners will provide the professional medical services of its practitioners to patients of the health system sites, and medical leadership and administrative services for the benefit of OU Health and its affiliates, and includes the compensation to be paid by OU Health for such services. And that is the Master Clinical Services Agreement. Thank you, President Harris, Mr. Williams, and Dean Zubialdi. That's our final document. Welcome to OU Health. Thank you all for joining and helping us celebrate this momentous occasion. Of course, the celebration's just beginning. We've invited our employees to join us for a reception. That's going to happen over the course of the afternoon, so please stay and enjoy.